Childbirth in America, Myths and Issues. Americans believe we have the gold standard when it comes to medical care, but childbirth is one of several examples where we are wrong. America has the highest maternal and infant mortality rate of all the developed countries. Issues happening today result from the beginnings of obstetrics, propaganda against midwives, unreliable technology, and drug intervention. Obstetrician was a made-up term to describe mostly male doctors who had received a crash course on childbirth. They did not have a solid understanding of a woman's anatomy, and this often led to fatal mistakes being conducted during labor. For instance, bloodletting was often used to ease the pain of a mother. This only created more problems such as infections, blood loss, and possible fatality. Women giving birth in the 1950s were placed in unnatural positions, often strapped down or sedated. Although today we do not strap the mother to the hospital bed, they are connected to multiple tubes and monitors so they cannot easily move. Being strapped down doesn't allow the mother to get up and move when painful contractions begin. A large myth revolves around midwives. They have been painted throughout the ages as informal or even dangerous forms of help for childbirth. They are often portrayed as dirty and sometimes even referred to as witches. In the past, midwives had no social authority and were considered to have incorrect knowledge. Midwives are actually trained and certified to complete a labor entirely on their own. They have many of the same tools and medicine that one could find in a hospital, and they are prepared to take women to the hospital if the emergency becomes serious. A major issue occurring in modern-day obstetrics is known as the C-section epidemic. Other countries have C-section rates ranging from 5 to 15%. In America, 33% of all births are C-sections, a rate that has increased 50% in just a decade. Many factors contribute to this epidemic, but two that are very impactful are the use of electronic fetal monitoring systems and drug intervention. The electronic fetal monitor is one of the most trusted pieces of technology within the delivery room. It measures the heart rate of the baby while it is still in the womb and is supposed to alert physicians to an increase in heart rate, indicating insufficient oxygen intake for the baby. However, it has a 99.8% false positive rate when alerting physicians to what they call fetal distress. The EFM is one of the major indicators that tells physicians to switch to a C-section. But how can you correctly determine to switch to a surgery when the machine you rely on is almost always wrong? Drug intervention is another serious issue with the labor process. Doctors induce women into labor with a drug called Pitocin. This drug is used to increase contractions in both effect and their rate. The resulting pain is often intolerable, causing many women to ask for an epidural. This in turn slows the labor process. When it slows too much, Pitocin is then used again. It creates a vicious cycle that can lead to fetal distress and puts both the mother and child at risk. The solution to this man-made problem is a C-section. Media portrays birth and labor as a fatal emergency. Women are screaming, people are rushing patients on gurneys around hospital hallways, but in reality, birth is a beautiful process. Although Americans create many of their own problems when it comes to childbirth, there are still many instances of women dying during labor around the world. Not only does awareness need to be brought to this issue, but you can help the cause. Every mother counts is a foundation that works to ensure pregnancy is safe for everyone, and mothers around the world have access to proper medical care. Learning about the issues of maternal death and donating to the cause are two vital ways to help this global matter.